Neurosurgeons in the country are warning the number of brain and spinal injuries that are increasing as a result of motor accidents lately will lead to many deaths in Ghana if there is no effort to increase the number of neurosurgeons in the country. Currently, there are only 20 of neurosurgeons in the country, a situation the specialists describe as dangerous considering the number of brain and spinal disorders that are recorded on a daily basis.
Ghana has only 20 specialists in the medical field of neurosurgery. That puts the ratio of neurosurgeons in the country to 1:1.5 million Ghanaians. The situation, according to the neurosurgeons, puts enormous stress on those in practice, considering the increase in cases of brain and spinal injuries recorded as a result of road crashes. At the first Congress of the Association at Elmina, consultant neurosurgeon at the Cape Coast Teaching Hospital, Dr. Kwesi Ajin Mensah, indicated there is an urgent need to get as many neurosurgeons in the country as possible to reduce the rate of spinal and brain-related death.
The cases of neurosurgery are on the increase, and yet neurosurgeons have not been increased appreciably over the past decade. Currently, there are only 20 practicing neurosurgeons in the whole country of Ghana. That is well over the world average of one neurosurgeon to about 152,000 people. So there is a dire need for us to train neurosurgeons to add up to the pool and to improve the services of neurosurgery in the country in general. Previously, people thought that brain surgery and spine surgery is non-existent, but that is not true. If you look at the rate of motor vehicle accidents and the outcomes that come out from that, I tell you, traumatic brain injury accounts for most of the deaths because there are non-existent services anywhere in the country.
The average number of years to become a specialist in this field is 8 years after becoming a medical doctor. By the end of the Congress, the association stated the curriculum used in training neurosurgeons was undergoing changes that might ultimately reduce the length of time of the training and the content of the training.
The reason why over the years doctors have not been interested in training as specialists in neurosurgery is that if you look at the length of training and how hectic the training is, and the person passes out and is on the same scale as any other specialist in any other field of medicine, it's a bit of a disincentive. If they look at the number of hours they will spend in the theater and in the hospital and the amount of work that goes in, I'm not saying the others are not doing anything, they are. But of course, they can also attest to the fact that the training is longer and the amount of work you put in is a bit more.
The neuroscientists want government to help construct a national center of neurosurgery that will help them deal with complex brain and spinal disorders that occur in the country. The Congress brought together neuroscientists across the world to exchange ideas in the field of neurosurgery, where the expectation is that the many and varied rich experiences of their colleagues would be shared. Richard Kwejonya Akon, JoyNews, Cape Coast.